Hola! Welcome to Case Stories by Dr. Josie, that's me, where you get to hear and learn stories from the hospital. Did you know addictive drugs like heroin and cocaine were used in the past by doctors as medicine, and they were used to treat different types of diseases? This is before they knew that these are addictive drugs. By the way, I post here stories, real life stories from the hospital, so if that's your kind of thing, kindly consider subscribing. Today I'm going to talk about outrageous medical treatments that were done in the past. I'll start with heroin. Heroin is known to be a very addictive drug, and in the past, this is as past as the 19th century, they used to put heroin in cough medication for children. They used to think the drowsy effect that it comes in with and helps the children not to cough. But they came later on to realize that it's just a highly addictive drug. And you can imagine a time where people could go to the chemist and order for heroin. Another case was cocaine. Cocaine mostly was used by eye doctors. They used to put it as eye drops. They used to say it used to reduce pain, reduce bleeding. But now when you really think of it, if you give someone cocaine, they're high, they won't really consider the pain as they would when they're sober. So these are bizarre things that were used to be done in the past, and no one used even to think they were wrong. This only shows you how medical treatment evolves and changes over time. One day something is good for you, the following day you're told it's deadly and should be avoided at all costs. The next thing we're going to be talking about is snake oil. Just as you heard, it was oil that was harvested mostly from Chinese water snakes, and people used to apply it on their body because they used to say it would act as an analgesic, meaning it will reduce pain. So people with arthritis and people who did odd jobs and hard jobs used to look for snake oil to apply on their joints, like knees, on the elbows. And I don't know how efficient it was. I think a study should be done to reveal, maybe it did work, maybe, I don't know, but would you consider applying snake oil on your body today? Our next bizarre medical treatment is the vibrator. Yes, the one that you know. Did you know that vibrators were manufactured? They were actually brought as part of treatment for women with hysteria. And it was, you can imagine, being prescribed one vibrator 2 times a day for treatment of hysteria. And later on, vibrators have now become things that people use personally for personal pleasure, but they were brought to this world as part of treatment for hysteria. I know you've heard about lobotomies, and if you've not heard, it's one of the most gruesome medical procedure that I think was being used in the 19th century. So lobotomy is basically a surgical procedure where the brain connections are severed, that they are cut. So how they used to do this, they used to use a tool that looked like an ice pick and use it and put it at the corner of your eye to reach up to the brain. So they would hammer the ice pick with a hammer, and it reaches up to the top of your brain, and then they wiggle it. So you can imagine they're wiggling it, and it's in your socket to sever the ties between the front of the brain and the back. They used to say that this used to treat psychiatric conditions. But if you really think about it, if you're severing the brain connections of a person, are they really then again a person? It's like you've cut out the conscious part of that person being human. Lobotomies were done as late as the 19th century up to 1960s. I think the last 2 lobotomies were done in 1967. Imagine. The next treatment was called shock treatments. As you've heard, yes, using electric shock. And it was considered to treat impotence. So people who could not give birth or people who are considered sterile were put in large buckets of more of bathtubs, and then the bathtubs are connected with electrodes, and you're subjected to electric shock for around 6 to 8 minutes. And this procedure was done 2 times a week until you're able to now give birth, or you're able to show that you can give seed. So you can imagine, for the people who are really sterile, how many procedures they had to go through with no improvement or with no results. It's such a bizarre thing, because let me tell you, I am afraid of electricity. I am afraid of electric shock. I was once shocked when I was young, and until today, you can never find me trying to fix anything that looks like wires. But in the past, people used to do that voluntarily. The next procedure is called bloodletting. Now, this I'd never had until I started doing research on the medical procedures that were abolished. Bloodletting was a procedure where they used to, how can I put this without sounding gruesome? They used to let blood drain. They access an artery in your body. They cut it open and let the blood drain to the ground. They used to say, as the blood is draining, it drains out with the impurities. And I think they also didn't grasp well about how blood loss, especially major blood loss, can impact you negatively health-wise. But it was later abolished when no improvements were seen, and many patients lost their life because of massive blood hemorrhage. You've seen waterboarding in movies, where they use it as a method of torture for the enemy to give up secrets. Waterboarding was used in the past as a form of medical treatment, where they would drown patients underwater until they're unconscious, and this was thought to cure mental illness. It seems in the past a lot of procedures were used to cure mental illness, but now we know that those did not amount to anything. And up to now, we still face a lot of mental health challenges and mental health treatments that are still and a lot are still used at experimental levels. The next procedure is called Zeno transplantation. When you think about transplantation, you know it's the transfer of an organ from a donor to a recipient, and it's mostly human. Now, in the 1920s, they used to do it from a monkey to a human. In which scenario? Imagine this. It's in the 1920s, you're a poor guy, you cannot be able to sustain an erection, you cannot be able to afford Viagra, so the doctor would recommend transplantation of your testicles with that of a monkey. And later on, people died so much because there's not much compatibility there, and also it did not cure the main cause, the main problem, and people used to die of infections. And some of these procedures, I cannot even explain why they were being done. I don't know. Maybe you can tell me. Comment down below. The other one is about malaria. We all know malaria, and we know we are supposed to avoid it. We know which areas are more epidemiological susceptible, mostly the lake basin and in the coast. Now, in the past, when there were no antibiotics, and you know about syphilis is only cured by antibiotics. So before antibiotics were discovered, syphilis was incurable. But now here's the thing. When you had a high temperature, when you had fever, syphilis would subside, because it's like it cannot survive in such a heated environment. So people we used to purposely get themselves infected with malaria, because we all know malaria gives you crazy fever. And then after you get the crazy fever, the syphilis subsides, and then now you start dealing with the malaria afterwards. As I conclude, we can say that medical treatments evolve and change over time. We may actually abolish things that we are using today and we are so trusting today, because as you've seen, people have been doing different things and trusting in them. And now when you think about it, you're like, why is it so bizarre? Till next time, ciao.